everyone. Today we are going to see about the psychometric assessments, that is the subtopic of motivation and emotional process. Before we had seen about the attitude, emotions and stress and adaptation. Today we are going to see about this. How does this test done in order to test the emotions and all. First of all, how does the motivation can be tested? By using these three techniques, we can do the psychometric assessment. Mainly three methods are available in order to assess the motivation. First of all, projective techniques, personality inventories and situational tests. Coming to the projective techniques, here what happens? It is also called as thematic apperception test. Here the researcher gives a series of ambiguous pictures and he says to narrate a story. What is going on in that picture? Then what happens? According to the subject, whatever he projects, his or her own needs into the behavior of that character he projects. Then finally the psychologist identify the needs whatever they projected and judges from the number of related items in the story. That is projective technique. Coming to the personality inventories. These are all the paper and pencil questionnaires. It consists of true or false, multiple choice questions about how the person behaves, habits, likes and ambitions. Then situational tests. Situational tests in the sense, here the subject can be put into real life situations and he kept under observation by the witness. For example, if the child get aggressive, it can be measured by giving them some dolls and observing the child how many times he get aggressive in that situation, and we need to do the something to distract them. That is situational test. These are mainly three methods in order to assess the psychometric motivation. Then coming to the psychometric assessment of emotions. Here there are mainly four methods available in order to assess the emotions. First of all, we will see about the galvanic skin response. Here the psychologist measures the activation of sweat glands during the emotional arousal that results in lower the electrical resistance of the skin. Coming to the ECG, in ECG it helps us to read about the changes in rate and rhythm of the heart during the emotional arousal. Then third assessment, EEG. EEG means electroencephalogram. Here the brain rhythmic activity will be measured in this test. Then finally other tests. Here whatever the changes in the muscle tension, breathing rate and blood pressure during the emotional arousal. These are all the four tests mainly we can use in the psychometric assessment of emotions. Then third one, psychometric assessment of attitude. Here the measurement of attitude will be done with the some Likert scale, differential scale and the sociometry. Mainly three things we can use in order to measure the attitude. First of all, opinion surveys, attitude scales and voluntary behavioral methods. First of all, opinion surveys. Here the survey is concerned with the reply to specific questions in which the people are asked to respond to the questions by expressing the personal evaluation. Then coming to the attitude scales, here what happens? It generally total score indicates the direction of the intensity of the individual experience. Finally, voluntary behavioral methods. Here the physiological measures like the size of the pupil of the eye will be indicating the arousal to measure the attitude. Recently, along with this, electromyography recordings forms from the major facial muscles. It also helps to use it to measure the attitude. Recently, the electromyography recordings were also used to measure the attitude and it is successfully established. Then these emotions during the illness, how does it changes? These all will affect during the emotions: anxiety, worry, fear, shock, denial, anger and depression. First of all, anxiety. Anxiety is a feeling of apprehension or uneasiness, hesitation if the individual anticipates the threat. For example, if the patient is going for any surgery, he will have the anxious feeling due to the fear. Second one, worry. It is a mild form of anxiety. It will be characterized by the preoccupation of a problem. For example, suddenly from school life we enter into a college life, we will have the worry that known people won't be there, new relationships will happen, lack of privacy and lack of understanding of other languages. Like that we will have the more worries. Coming to the fear, it is an emotional state that is characterized by a expected harm. Fourth one, shock. Shock is a response when patient or families informs a severe or life-threatening illness. Coming to the denial, here this mechanism avoids the emotional conflict. For example, if we take into consideration one family, suddenly in that family some person got affected with the cancer, then others what they will say, the cancer may get reduced. Like that they will give the psychological support to the person who got affected with cancer. They act like they denied the thing. Coming to anger, anger is a feeling that struggle with the threatening or the unpleasant situation. Coming to the anger that is the emotional state which characterizes the feelings of frustration and struggle with a threatening or a unpleasant situation. Coming to the anger that is a emotional state struggles with the threatening or unpleasant situation. Finally, depression. Depression, it is characterized by a dejected mood. The depression occurs due to the absence of or loss of personal control. Role of a nurse in emotionally sick patient. How nurse helps the sick patient? Spend time with the patient. First of all, she need to listen the patient how the patient felt, whether she is happy or sad. Then facilitate the verbalization of feelings. Here, she need to explore her feelings and emotions. Then coming to third one, handling the emotions. Handling the emotions in the sense, here, if the person was in a more distress, they need to cry loud. Thus, they need to express their emotions out. Then orientation of patient to the healthcare facility. Here, we need to explain the patient how the treatment process will goes on and where was the OPD investigations department. Thus, the healthcare facility orientation must be shown to the client in order to relieve their emotions. Then coming to the fifth one, identification of learning needs of the patient. Here we need to identify if the patient have some doubt regarding the treatment process. We need to explain them clearly how the treatment works and by using the treatment how that got reduced. Thus, we need to identify their needs. Providing the diversional activities. Nurses plays a major role in order to cope up with that situation. So, she need to provide the diversional activities like to explain them to listen to some music or do some prayer. Like that she need to divert the client. Taking care of insomnia, food and fluid intake. Whenever the patient comes to the hospital, mainly these things will affect due to the disease condition or due to the exposure to the new environment. So, in order to reduce these things, she need to explain and take care of this food and fluid intake. Coming to the eighth one, maintain cheerfulness and humor. Here, the human emotions will be more contagious. So, the patient tends to enjoy to have the persons who are cheerful and professionally competent. So, nurse need to be cheerful in all the time. So, nurse need to be happy and cheerful at all time. Finally, they need to seek help of mental health professionals. The patients who ever experience the serious and prolonged disruption in their lifestyle, they need to attend the healthcare professionals compulsorily. So, nurses should provide the information about where are the sources of mental health care in the community. She need to explain the thing and counsel in order to support emotionally. Thank you guys for watching this video. Please do like, share and subscribe. Thank you one and all.